So I used to be a flight surgeon for the Air Force. I did emergency medicine for 30 years, some part-time, mostly part-time, then full-time, then part-time again. And what I've learned as I started doing all that was that in medicine, we don't have a lot of, our training and our system doesn't teach us how to help maybe the root cause of people's problems. We're taught to fix and cure, which that means, you know, the patient comes in, you talk to them, you look them over, you draw blood tests, and you make this diagnosis and you offer them this prescription or this surgery. It's kind of a fix and cure, kind of a sick care system as opposed to a healthcare system. But rarely does it teach us to focus on the root cause of the problem. So I discovered that about 20 years ago, so I got real nosy. You come to me, I lift the hood, kick the tires, check the oil, draw blood work, you know, we look under there. And if we can find a root cause of the problem, oftentimes it may be hormonal in nature, fix that, then down comes the need or eliminates the need for the fixes and the cures in the first place. So people come to us and we can get them off medications. See the difference in philosophy? So I think the greatest medicine of all is to teach people how to not need it in the first place. Kind of cool, isn't it? That's a functional medicine. It's a precision medicine approach. So tonight we're going to talk about these 5-6 bullet points. What are hormones? What are they actually? And what are the differences between the synthetics, the pharmaceutical made synthetics, and the bioidenticals, meaning human identical, meaning isomolecular, meaning the actual molecule produced by the ovary and the testicle, okay? What are the different ways in which we can put it into our bodies? How can they help both men and women? What are the risks, right? You hear about, oh my gosh, what about these risks? Could happen to me if I do this. If those are even real, we'll talk about those. And then whether or not tonight here you're a candidate. And usually by the end of the night, the only simple question I'm going to ask you is, does it make sense to get your blood drawn? That's what I'll be asking you at the end of the night. That's all. Okay? Sound fair? All right, so here we go. Healthcare, that's what I was taught to go into. You know, I was one of these childhood dreamers, always want to be a doctor when I grow up, and sure enough, it happened. And so I entered the system and I was taught I thought I'd go learn how to give health, but I was actually taught disease. I was taught diseases and how to manage diseases. And so that's what they kind of tricked me all along the way, and that's when I realized, like I said, we got to look for the root cause. So conventional medicine says this: we're born, we come up to 10 to 20 years of age, and we're at our maximal reserve capacity. And then after that, we start losing that capacity, starts heading downhill. By the time we're 60, 70-ish, now we're not feeling so good. And medicine says, well, we can make you live longer. Okay, we can make you live longer, but the problem is they haven't helped fix the root problem that's making them feel bad in the first place. So the quality of life is not focused on. We're focused on living longer. And I don't know about you, I don't mind I'd love to be 70, 80, 90, 100, as long as I don't have to be curled up in a bed somewhere and I can be out and about and a productive member of society. Okay, so that's my interest. And so there we go. That was me. There I am at the bottom of the cliff. There's me in the ambulance, scrambling frantically to catch patients as they fell off the cliff into my ER. And I'd either treat them and admit them to the hospital, or I'd treat them and street them, send them home to their family doctor, what have you. And that got old real quick. And I found a lot of patients were asking me, hey, isn't there any way I could have avoided this in the first place? Especially when they get a bad diagnosis or something severe. What can I do to have not needed that happen or prevented that in the first place? So we're all about putting up guardrails. Yeah, father of modern medicine, William Osler, said it best. The person who takes medicine must recover twice, once from the disease and the second from the medication, because they all have potential side effects, right? And this challenge came to us 4,000 years ago in the first ancient Chinese medical text. Superior doctors prevent the disease. Mediocre doctors treat disease before it's evident, and inferior doctors treat full-blown disease. Now, I say that a little tongue-in-cheek because I'm the ER doctor treating full-blown disease, but I've never seen them before. So they came to me long before I had a chance to touch. And so that's kind of our challenge. So there we go. Here's what we'll focus on. The goal of preventive regenerative medicine. So there's that curve, 10 to 20, but as it starts dropping off, now we want to extend the quality of life, extend the vitality, keep you having the energy that you want, all the things that you value in your life to keep you a productive member of society until the time, and then of course you'll probably live longer because your quality of life is, but you retain all of that. So that's a longevity, vitality, extension a way to think about it. So we want to give you health span, not just lifespan. Are you following me? Within your lifespan, we want to give you that quality of life and then also have you live longer. These two people are the same age, big difference in their quality of life. Would you agree? All right, so functional medicine approach, right? That looks a little complex, but look at these little blue circles. All right, so the one in the center says depression. Well, if the guy comes in and he's having depression symptoms and sad and can't sleep and maybe thinking about bad thoughts, conventional treatment says, here, let's give you an antidepressant. Well, my question is, well, does that guy really have a Prozac deficiency? Does he have a Wellbutrin deficiency? Does he have a Zoloft deficiency? Not necessarily. We might use that temporarily to treat them, but what about what's going on with his hormones and his vitamin D and his thyroid and all those other things? Those are root cause contributors. Fix those and now you reduce or eliminate the need for the medication as long as he responds to that, right? Okay, so here's what you need to know. Number one, not all hormone therapies are created equal. Number two, hormone replacement is not a one-size-fits-all cookie cutter. All right, it has to be individualized. It has to be customized, not general broad brush, focused on the person. You need an expert, and you want to focus on a concept called optimization, not just normalization. So what is optimization? So if you go and get your blood drawn, okay, you're going to get a lab report. One column is going to say, here's the name of the blood test. The next kind of column is going to say, here's the result. And the third column is going to say, here's the reference range or the reference interval. What that means is the upper and lower borders of a bell-shaped curve. So they survey the general population. A bell-shaped curve gets drawn. 95% of the population is going to fall under that. And that's the reference interval, okay? What happens, though, is that we all at some point reach a season of our life where we say, I don't feel myself anymore. How come I'm tired all the time? I may have dry skin, brittle nails, foggy memory, constipation, low energy, elevated cholesterol, brain fog, cold hands and feet, poor libido, no results in the gym, my sleep sucks, my joints ache, I got hot flashes, night sweats, bladder. If you want, I'll keep going. And so we don't know what to do at that point. So people just nowadays, they just Google it, right? They just Google everything, right? Dr. Google sends me all kinds of patients. And it may say, like, go get your thyroid checked. Okay, great. You go get your thyroid checked. And remember that curve I was telling you about? It might land over here on this lower part of that curve. And so they call you on the phone and they say something like this. Hey, Adrian, we got your blood test back. Looks to us like you're in the normal range. That's the words they like to use. I used to do it all the time. I didn't know better. Don't blame me. And yet you don't feel normal. Remember, you live in your own body. No one else does. And you know you're not feeling your normal. And so we don't ignore that. We treat it. So we now move it to this side of the curve. Because that's where it was 10, 15, 20 years ago when you were at the season of your life and you felt your best. And what happened is over time it just drifted down to the point where it created symptoms. Okay, so when I move it over like that, we call that optimization, right? In essence, what we're doing is putting you in the upper quartile of the reference range. Make sense? Follow me? Okay, here we go. Yeah, so you can have labs that say you're normal, but you don't feel normal. Okay, so you want to be in that optimal range. So here's what hormones are. They're like a lock and key. How many people here have ever heard of a compound called insulin? Yeah, that's made it to Cape Girardeau, right? Okay. Insulin helps blood sugar go from the bloodstream into the cell. It's like a lock and key. It opens the door. It's a messenger. What happens, so here's the question, do we lose our hormones because we age, or do we age because we lose our hormones? See, I think the aging process accelerates in the absence of hormones. Okay? Here's what you need to know. We talked about all this. What did I do? Get a duplicate slide somehow? Maybe I hit the wrong button. Okay, here we go. Do you feel like this yet are told your labs are normal? Or do you feel like this and you have optimal labs? Or do you feel like this? Or do you feel like this? Or do you feel like this? Let's see here. Let me back up. I think you just got a hormone imbalance. That's really the root cause. I mean, you can just get right to the point, right? Okay. So there you go. Sound familiar? Look over that list. I'm not going to read it to you. How many of you know someone that has some of those symptoms? All right. 2 of you? 4 of you? Okay. All right. If you're with somebody, don't sharpen your elbows or do anything like that. The good news is it's likely hormonal. Okay. So fatigue. What do people typically do when people get tired? What do they do usually? Take a nap. What else do they do? What if you can't? You're at work and you can't take a nap. What do you do? Caffeine, right? How about energy drinks? They sell energy drinks in the city? Yeah. What are like what? Monster, Red Bull, stuff like that. What do those run? I don't know because I don't buy them, so I don't.
Now you can buy a level. Like a level 2 is 160 milligrams.
Okay, so it's specific. But
like $8 or $10?
What do they charge for that? I don't know. Okay, so what if you just go to the quick gas station and you grab a can? What do they run? I don't know. $4. Okay, that's about right. All right. For a Monster, whatever. There's the 20 ounces and all that kind of stuff, right? So here's a good question. Does the body have a Monster deficiency? We treat it with that, right? I got one patient comes in, I remember this guy, 25, sits on my desk, he goes, man, I'm just tired all the time. Really? I go, okay. I go, how do you handle that? He goes, well, I use energy drinks. I go, oh, okay. You use energy drinks? He goes, oh yeah, I take one every day at 3:45. And I'm like, okay, well, how do you choose that time? He goes, cause I drink and I know exactly how long it lasts, and that way allows me to finish my work, drive through traffic, go home before the crash hits. So he's got it timed out because he knows what? If you borrow energy from the future, you have to pay it back. And that's when that crash hits, see? So anyhow, we pay very close attention to how people feel. We're very interested in that. In fact, conventional medicine says treat the blood test, not the patient. Functional precision medicine, that is hormone medicine, we say, no, treat the patient, not just the blood test. The way we assess that is you fill out a paper. You self-rate on a scale of what, 1 to 5? All these different areas. You got some of those tonight?
Yeah, they're back.
Yeah, okay, so you don't need to do with it right now, but before you leave, yes ma'am, thank you. One side should have male, the other side should have female. Okay, perfect. If it doesn't, make sure you get one that has double-sided, okay? And the reason is, you might know someone that's on the opposite gender that could also benefit from this. So you fill it out, but you don't let anybody see it. If you're with somebody that you care about, no cheating, don't look on their paper and say, no, you're a 3. You're a, no. Okay, so don't do any of that, because that's the before picture. And then what we do, if we do treatment, is we recheck it in 4 or 6 weeks, and we lay them side by side, just like this. Because we want to make you feel better. We want to make those symptoms go away, and that's how we pay attention to that. Not just, oh, your blood test looks fine. No. How do you feel? Okay? All right. Here we go. There it is again. As hormone levels drop, all these symptoms show up. Recognize any of those? Energy, mood swings, weight gain, joint pain, difficulty sleeping, brain fog, low libido. Look what happens when you restore the hormones. It comes back, right? So that's kind of cool. So here's what the BioT method does. We balance testosterone, estrogen, thyroid, and vitamin D, which is actually a pro-hormone. and we use medical grade nutraceuticals to make the pellets work better and last longer. All right, so let's talk about andropause. Andropause is male menopause. Some would call it manopause, right? 20% of the males over age 50 have low. It is way more common. I would say 80% of the males over 50. I would say half of the 30-year-olds have low. Unbelievable how common it is. And if they have problems with diabetes, blood pressure, sleep apnea, that's probably a root cause of how it landed there in the first place. They're interlinked. So it's way undiagnosed. You need a blood test to be able to tell. So testosterone. Okay, so here's what it does. It gives you major symptom relief for bones, brain, breast, heart, prostate also, by the way, and relationships. So it's present in both men and women. Large amounts in men, smaller amounts in women. Men 30 to 70 lose 1 to 3% per year. I will tell you it is way higher than that. And women start losing it at age 20. 15 years before the menopause starts creeping in, they start losing, the ovary starts failing. And they can lose up to 50% per year, okay? So testosterone is the dominant hormone in men. Let me ask you, women make testosterone. I was impressed to learn that women make more testosterone over the life of their ovary than they do estrogen. So if you ask me, let me ask you, is testosterone a male hormone? Right. In me it's a male hormone, but in you it's a female hormone. Okay? There's the root cause. People might show up, you know, I'll have some men come in and say, hey doc, by the way, before you leave, do you have any of those little blue pills? Well, I know all the rest of the stuff's going on this guy if he's asking for that, because it's a whole arterial situation. So here's an important chart. You're welcome to take a good picture of this. So this is blood testosterone levels in young males, okay? Levels should be 800, 900, 1,000. In this day and age, they're not. We lose a few percentage points per year. It starts in the late 20s, cumulatively. And then what happens as my testosterone drops, I gain weight around my midsection, and I don't like that. And my muscles soften, and I don't like that. And as it drops below 900, I lose the protection for Alzheimer's. In the 800s, my risk for prostate cancer goes up, not down. In the 700s, I get metabolic and my bones begin to thin. In the 400s, my blood sugar's going up, my energy's dropping, my libido's dropping, my cholesterol's going up. When I get to the 280s, depression, anxiety, PTSD symptoms surface. Not till it gets clear down there, oftentimes in the low 230s, is the plumbing a problem. That's the last thing to show up while all these other things above it are in play. All right, that'll bring a man in the doctor's office faster than anything. My phone rings right away, but all this other stuff is going on. So us men, we not only we need our testosterone. What do we need it for? We need it for our brains and our bones and our hearts, not just our relationships. So the therapy I'm describing to you will ramp you right up here to 1,000 men, maybe 1,200, and you're off and running for 4 to 5 months. For ladies, we scale all this way down. A lot of it's still in play. Instead of prostate cancer, it's breast cancer reduction. And that lasts 3 to 4 months. Okay? I get asked this question, hey doc, I heard that I can't take testosterone because my dad had prostate cancer, or I've had prostate cancer, and I heard testosterone causes prostate cancer. Nope, never has. 19 studies showed no increased risk of prostate cancer in men with testosterone therapy. In fact, it's the men that have low testosterone that show up with prostate cancer, and then it's more advanced in their disease, and it's a higher Gleason score and a higher classification. So it's protective for prostate cancer. So what did testosterone do for men and women? There it is. You get back your energy, your feeling of overall well-being, relief from anxiety and depression, improve mental clarity, improve memory, focus, enhance libido and performance. Now we're protecting the breast and prostate from cancers. Now we're improving the brain function, the heart function, and the bone protection. We're getting stronger bones and muscles. We're lowering body fat percentage. Does anybody here know someone that would like to lower their body fat percentage? No one? Okay. Yeah, I would. I'd like to lower mine. Okay. Cholesterol, look at all the bad cholesterol numbers are going down over months and months, and the good cholesterol numbers are going up. That's because your body leans up, your fat constant component drops, the muscle increases, and so you start burning through and get better cholesterol numbers. I ought to give you a little sneak peek into underneath my skin. This is called a coronary calcium score. You can go lay in a CT scanner, hold your breath for 10 seconds, and these high definition CT scans can scan your arteries to see how much calcium buildup you have. Okay, so I went and did that. You're sitting in the front row, aren't you? Can you read that top line that's highlighted? It says total calcium score is what?
0.
It says 0. Wow, that's the first time in my life 0 was good, right? And then it says my coronary heart age is what? Less than 35. I don't know whether that means 29 or 25 or whatever that means, but I'm thankful. My wife, same score, okay? So that's kind of cool. That means my chance of having a heart attack in the next 10 years is less than 1%. I'm thankful for that. And I can call most all y'all in the room young man and young lady, I think. Okay. Ladies, menopause. 3,500 women enter it daily. Symptoms begin up to 15 years early. They're more affected than they realize. Most women don't ever get through it, and they're completely asymptomatic. All right, let me describe to you what the accurate diagnosis or description of menopause is. We're all thinking, and us doctors, we're responsible for this, I think, or the medical system, is that menopause is a room with 2 doors. The lady comes up to the first door, she gets perimenopausal, she goes through the door closes, she's in the next room, menopause kind of happens, and then she goes out the back door, now she's postmenopausal. Sound familiar? Okay, it's wrong. Here's the correct description. She approaches the door opens, she might be in and out of the door a little bit, finally the door closes, there's no handle on the back side of the door, it slams shut, you can't go back through once you're there, and then she's in menopause, which is a room the size of the rest of her life, including all the symptoms, whether or not they're there, including Alzheimer's, osteoporosis, and heart disease, which is the reason they pass. Now that, to me, is spooky. You don't leave menopause, you're in it for the rest of your life. It's ovarian failure. We don't want it to happen, it's physiologic, but we can protect against that and we can reverse it. When the testosterone drops, the heart disease starts cranking in, ladies. When you lose the estrogen, it more than doubles, up to 1 in 3, because estrogen is protective for heart disease. So is testosterone. So estrogen, present in both men and women. Yes, us men have estrogen. We need estrogen. It's what makes us nice, right? We don't need a lot of it, but we need a little of it. If we don't have enough of it, we're edgy. Yeah, we're out in the street picking fights with the nuns. We can't do that. Yeah, so we got to have some estrogen. We make it because we convert some of our testosterone into estrogen, all right? Large amounts in women. It has over 400 functions in the body for women, controlling hot flashes, maintaining the skin. It's their happy hormone, keeps their bones strong, maintains their memory, prevents them from getting neurodegenerative diseases. It also lowers their cholesterol and again protects them from breast cancer. Not causes breast cancer, it protects from breast cancer. So hormone therapy, that's what, now you know why people want hormones. Okay, so here's your 2 columns of choices. Left side synthetic, different ways to get in the body, pills, patches, creams. Right hand side bioidentical, human identical, isomolecular, the same exact molecule produced by the ovary and the testicle, okay? And there's different delivery systems for that. Here's the most popular. I'll tell you why shortly. This is the old study that was happened clear back in 2002. Back in that day, we used to have these things called magazines. Some of you don't know what those are, do you? Yeah, the young crowd, we're all giggling. Yeah, there was one called Time Magazine, Newsweek, right? There's a study came out. They thought it was a study that could never fail. It was flawed. They drew the wrong conclusions. They didn't know at the time, but they were wrong. And they said, oh my gosh, hormones cause stroke, heart attacks, breast cancer, blood clots, and Alzheimer's. So everybody came off their hormones. All the doctors got scared of it, hormones. They stopped teaching hormones to residents. They stopped teaching hormones in medical schools. And so there's a whole generation of women that went without their hormones, except the smart ones that stuck with it. All the rest of them died off early. And they found that they were wrong. There was only one arm of the study that caused this. It was the ladies who took the oral estrogen that had a synthetic progestin in it. That arm only caused the things that you see on the screen. But what they do is they broad brushed it and they say, well, all hormones must be bad, rather than the specific ones which were bad. But that fallacy still lives on today. How many of you know someone that you've heard them say, oh, I can't do hormones, they cause cancer, I don't want cancer? Myth, conjecture, urban legend is not true. Not all hormones are created equal. It depends on the type. It depends on the delivery system. It matters. So different ways to get in your system. Patches, right? You can put it on a piece of skin. It absorbs through the skin. You use it once every 3 days. The problem is, depending on what part of the skin is, if you have thicker skin, it doesn't absorb much. You get thinner skin, it changes all the time. Your levels are like this. Most people, 45% of the people don't absorb through the skin. Doesn't absorb. Gels, same problem. You got to put it on twice a day. It can transfer to babies and pets, right? We've had males dads hug their little babies, unbeknownst to them, then the baby develops pubic hair because of the testosterone gel. Wasn't happen, but it's not dangerous, but it's like, that's not okay, right? So men do shots. That's real popular, right? Here's the challenge with shots. You take a shot, you get a big burst of testosterone. Your levels go to 2,500, maybe 3,000. You make too much estrogen, so you have to take an estrogen blocker. And then it wears off. And then you feel horrible. So what do you got to do? You got to take another shot. And you get a surge, and it wears off, and it goes down. And so you're going through life like this. And sometimes everybody else knows what's time for your next shot before you do. Okay? Right? Okay. Problem is it can raise cholesterol and all those kind of things. It's synthetic. So bioidentical, human identical, isomolecular pellets are the way to go. These things are natural plant-derived compounds. They've been around for 80 years. They last longer than any other treatments. It's the same exact hormone produced by the testicle and the ovary. Individualized dosing, customized to your body weight, your kidney function, your frame, your activity level. That all goes into account when we dose you. Again, they've been around a long, long time. 80 years, primarily in Europe and Asia. Here's your comparison. So the purple line says when you take a pill or you do a troche, right? You use it, it wears off. You use it, it wears off. So all day long, you're like this. There's the patch, lasts 3 days. Excuse me, lasts 3 days and goes away. There's the implant, the green. Okay? Steady state. But it's better than steady state. What happens is the more blood flow that goes by the pellet, the higher levels you enjoy. It's released based on cardiac output. That means the more you work out, the higher levels you enjoy, which is how your body works. Okay? If you sit on the couch, you got Velcro on the butt, hormone, you don't get much hormone. But what happens is you start feeling like it, so then you actually can act on the feeling. You go to the gym, you get the blood flow, you feel the result. Okay? Okay, there you go. BHRT method, right kind of hormone, individualized dosing, pellet delivery system. Again, safe, evidence-based, 75 years of experience, clinically effective, implanted a few times a year. Best method to increase your bone density. It lowers your risk for cancer, not raises it. It says it does not stimulate tissue. I'll just tell you it actually has been now clinically studied and shown to reduce your risk of breast cancer. And if I told you how much, you wouldn't believe me, but I'll tell you shortly. It does not cause blood clots or heart attack or strokes, and it's protective of the brain. All right, breast health. This is interesting. Testosterone implants do not increase the risk of breast cancer, unlike oral synthetic hormones can. Treatment does not increase the risk of breast cancer. The largest study ever done on breast cancer was not this one. This was actually 20 years ago, before WHI came out, before the Women's Health Initiative, showing reduction in breast cancer occurrences, reduction in breast cancer illnesses, and reduction in breast cancer death rates by using hormones. Okay? I'll just tell you the largest study ever done was released, I think it was last April. European Journal of Breast Health, largest study ever in the world done on breast cancer. And they showed a reduction, and these were not all low-risk ladies. They were high-risk ladies, low-risk ladies, premenopausal, menopausal, they had the whole gamut. A reduction in the occurrence and incidence of breast cancer by, are you listening? 40%. 40. Not 5, not 10, 40. Okay? What else could you do in your life right now that would lower your breast cancer risk by 40%? What could you take? There isn't anything. Hormones will do it. Yes, even if your relatives have breast cancer, you can use it. How about osteoporosis? Anybody with osteoporosis? Unfortunately, when you break your bones, you can get sick and you can't move, so you can get pneumonia, and when you get pneumonia, sometimes you don't recover, and the death rates are upper 30%. Once you get an osteoporotic fracture and you get pneumonia, you die. So more women die each year from complications of osteoporosis fractures than they do of breast cancer. That's how common it is. We can build bone at 3 times the rate with pellets. 3 times the rate of the best prescription drugs out there. Osteoarthritis. How many of you here know someone with arthritis? 4th leading cause of disability. Testosterone is a very potent anti-inflammatory. It calms those joint pains. Okay. Brain health. There's the Alzheimer's stuff. Women get Alzheimer's. It's unfair, but 8 times more common than men. 8 times. It's because they lose their estrogen. Men with low testosterone are 3 times more likely to develop it. How about heart disease? I'll just tell you that testosterone is protective for heart disease. We used to use it to treat angina before they developed nitroglycerin. Testosterone was used to treat breast cancer before they developed chemotherapy. Okay, it's been around a long time. And the largest study on testosterone therapy in high-risk males who have already had their first heart attack, they already have heart disease, they were put on testosterone gel, and they showed no increase in death rates or whatever from that. It was just released and published last week. It's called the Traverse Trial. I was a principal investigator for that for 5 years. What else is important? Thyroid, vitamin D. Thyroid is metabolism, hair, skin, and nails. And women, you get to have progesterone. Us men don't get it. Women get it. Helps you feel good, relax in the evening, sleep better. So for the millions of patients seeking better alternatives to the traditional Band-Aid approach, you want to lead the shift toward true health and wellness, and it's evidence-based medicine. If you want healing and not just fixing and curing, pellets are the way to go. So the next step is, if you know someone who's having these symptoms, have them fill out the paper so they can rate them, and then have them get their blood drawn. Remember I told you at the beginning? All I'm going to do is ask is, would you like to get your blood drawn? And if the answer is yes, she's got some good news for you that we're going to tell you at the end. We're not going to tell you, those watching this video, you have to have been here live to get this answer. So when they watch this recording 6 months from now, the answer comes on after we shut the video off. Have your blood tests. Find out what your numbers are. I've yet to meet the male that guesses how low their testosterone truly is. They all guess it way higher than they think that it is. And when it comes back low, they're like, oh my gosh, no wonder that explains things. I see it all the time. There's your comparison. Shots. Males that do shots, if they're doing it properly, they should do it twice a week. Half a dose twice a week. How many weeks in a year? So it's 104 shots a year. It's hard to get excited about 104 shots a year. Creams twice a day, so 730 times a year. Pellets 3 to 4 times a year. Twice a year if you're male. Potential temporary concerns. Testosterone, bless you, makes the kidney work better. So sometimes when you do the testosterone pellets, you might have a little temporary fluid restriction. That's what happened to me. I got a little bit puffy. I got to feel like what my wife feels on a monthly basis, or used to, right? So what did I do? I took a diuretic, got rid of it, never came back. And I've had 18 insertions, 18. over the course of 8 years. Yes, I drink the Kool-Aid. And I like the Kool-Aid. It's good Kool-Aid. So you could get some swelling. If the breast tissue hasn't seen estrogen in a while, it can have a little tenderness. So we can just give you some evening primrose oils capsule that'll take it away. The pellets will uncover if you have like a hidden polyp or a hidden fibroid. You could actually have a cycle if you're done with your cycles. We just know that. We fix it. We get rid of it. You could pop out a pellet if you don't honor the temporary restriction we give you for a few days. You could have some acne temporarily. We just give you some antibiotic to take care of it. Men can experience a temporary reduction in the size of the testicle because the swimmers go to sleep. So any men that are in the fathering-bearing years of their life, we have you don't use this, we have you do something else. And then when you're done with the kids, then we can go ahead and start you on testosterone. And we use a compound called DIM to help reduce that, so it's temporary. Everything's temporary. Key hormone facts. There you go, summary slide. It can occur at any age. Not all therapies are created equal. It is not a one-size-fits-all. Low normal may not be optimal, right? And just get your test. All right, so special guest. All right, has anybody here used BioTE pellets other than me? You have. I don't want to make you feel uncomfortable, but would you please consider sharing with the group what you feel that it's done for you? How about you, Adrian?
I'll go first.
You want to come up?
Notes, yeah.
Yeah, you don't have to look at your notes. So
Oh, I need my notes. I'll go over
you can
these.
use your notes. It's okay. So this is Adrian. Come stand up here next to me.
There was too much to remember.
So I'm going to just ask you, how were things in your life before you got extra hormones? What was happening in your life?
I was really to the point of depression. Both of my daughters came up to me when they're like, "You've got to do something. You're depressed." I was lethargic. I had zero energy. Mood swings, lots of mood swings. Gotta look at my notes.
Yeah, tell your story.
Oh, I had such difficulty concentrating for my work. And my husband was finishing my sentences for me. Now, we have been married for 25 years, so that's okay. But, you know, he shouldn't have to finish every sentence. I had severe hot flashes, night sweats. I wasn't sleeping at all. And then I wasn't really aware that this would correct this, but I have been a runner for most of my adult life. And probably the last 2 years, I've had a lot of pain in my hips and my joints and my hip flexors. And Susie and I were talking one day right before she did it, and she goes, "Oh, well, my husband has hardly any pain anymore, like no joint pain." And so within, I would say, 5 to 7 days, I could run again as if I was running when I was 35.
Wow.
It was almost immediate.
Wow, congratulations.
So yeah, it's worked wonders for me.
Okay. Any other improvements that you're enjoying now that you've done it?
My libido's pretty good. My husband likes that a lot.
Good.
But I mean, that's about it. Those were the main things. Mainly, it treated my menopause symptoms
Good.
to where I feel like a normal person again. You don't realize how bad you feel until you don't feel bad anymore.
Well said. Thank you for saying
You're
that.
welcome.
Give her a round of applause, right? So joint pains are a significant symptom of menopause. So are bladder symptoms, leakage, sleep troubles. It's not just hot flashes and night sweats, it's a whole host of things. And your risk for breast cancer is now lower. And your risk for heart disease is lower. And you're protecting your brain from cognitive decline and dementia. You guys talk. I'll hold that for you.
Okay, thank you. I think I know everyone here, and I don't care to say how old I am. I'm 46. And when I started this journey to hormone replacement therapy, before I was going to add it here to something at the spa, I always go through something, do it to myself before. And I'm like Michael and Adrian, I didn't know how bad I felt until I felt good again. But when I was about 42, I stopped sleeping through the night. And I was working in neurosurgery at the time, at some pretty hefty hours at times. And I just always attributed it to my busy schedule. And so, fast forward, I get pelleted, And within 2 nights, I slept through the night. And I thought, that's got to be a fluke. That can't be right. It's up here. I've slept through the night ever since. And meaningful sleep was a huge game changer for me. But since then, I've also noticed, yes, my back and my joints don't ache anymore in energy. I have a ton more energy than I had before. And so patients ask me, well, kind of quantify that. I'm not out running marathons, but used to, when I went home after work, I was down for the count on the couch. You didn't get any more out of me. It was spent. I was already done. Now I can accomplish things. I go home. I cook dinner now. I do the dishes. I'm gardening. I'm like, I can keep going and keep going. And I'll never not do it now. I'll never not do it. My background in neurosurgery, I take care of these little old ladies that come in, and sometimes men, that sometimes start in their 50s, but 50s, 60s, 70s, 80s, they've broke their back because they have osteoporosis, and I'm fixing it, with a procedure called a kyphoplasty. And we make them better, but in about 2 or 3 weeks or 2 or 3 months, they're back. They're repeat customers because the underlying cause is not fixed. And so I walked through this journey with my own mother, who broke her hip about 4 years ago, and the treatment is Prolia. It builds your bone mass back by about 1%. And she's now doing bioidentical hormone replacement therapy, which builds your bone back by 8.3%. 8 times more.
8 times.
8 times more. There's nothing else on the market that will build your bone density back like bioidentical hormones are. So for me, I've seen enough of these elderly women and men that I was just like, that's not how I want to go down. I'm not going down like that. I am going to do something to treat my bone health. So for nothing else, I will do that because I've taken care of so many people in that condition. So.
Thanks for sharing that. Yeah.
Susan, did you or any of you have side effects after you first took
But
it?
she asked us, was there any side effects?
So I had the fluid retention, and that was transient. It lasted maybe a week or so. I took a diuretic one time, I was done. And then my subsequent pelleting, I didn't have that side effect. I will say, this is maybe getting way personal, but I shave my legs every day anyway, but you're probably going to have to shave more often. But
Or you laser them.
or you laser them. But besides that, I didn't have any ill side effects.
All right, so I'll skip over this part here real quick. These are patients of mine that send me pictures. I tell them once I get my text number, they send me. If you send me a picture, it could end up in a presentation somewhere. So there it is: increased energy levels, restored zest for life, increased libido, relief from anxiety, depression, PTSD, lower body fat, greater capacity for getting in shape. These are just stories that my patients have texted me. Yeah, some of this is all legit. Okay, we'll go on. Nutraceuticals. These are just things that make the pellets work better and last longer. So, yeah, you want to be on those. All right. I've been doing this 8 years. This is the most remarkable thing I've ever done in medicine. It's changed me personally. It's made me a better physician. It's made me a better husband and a better father. It's remarkable. I should have learned about it a long time ago. They asked me to teach, so I actually teach and train other physicians how to do this now. So last week I had an audience of 50 doctors in Tampa, and then I'll be doing Houston and then Chicago and all these things. So it's not me, it's just that we're trying to get the word out to other healthcare providers so that they can help the public, okay? Because you need a qualified person that's an expert to know how to do this. It will absolutely be a remarkable impact in your life, and it could be life-changing for you. I don't want to oversell it, but I'm just telling you, it all starts today with a simple blood test. That's all it is. Simple blood test, a symptom checklist, and then meet and go over your blood work and get your consult done, and then analyze that for you, okay? All right, let's field some general questions general questions. I want to respect your own private, personal, medical situations. Come up to me after the video if you want to ask that, but for the general group, general questions before we end the video. Yes, ma'am.
So, I know hormones are also kind of related to weight gain, weight problems. So, when you're taking these, when you're doing the pellets, is it, are you losing weight because you have more energy and you're doing more stuff, or is it actually because of the hormone?
Right.
You understand
Great
what I'm
question.
asking?
Yes, I do totally understand that, yeah. So what happens with time is, so testosterone will start helping you build muscle if you're trying to build muscle, if you're doing resistance training. We want everybody to begin doing some resistance training, and the main reason is that muscle is the currency of aging. If you build muscle, you will in turn build bone. Okay? As you build muscle, that's a furnace of your body that turns up the thermostat that starts burning the fat in our bodies. So it is a secondary effect. The scales may actually go up initially, but the size starts dropping. So when people say, I want to lose 20 pounds, what they're really telling me is, I remember how I looked when I was 20 pounds lighter and I want that back in my life. More so how their clothes fit and those kind of things. So your body composition will change. You may, of course, lose some weight, but you don't want to lose the muscle, you just want to lose the fat. Does that answer your question? Okay. Yes, ma'am.
I have two questions.
She has two questions.
I have ankylosing spondylitis.
Okay, she has AK,
Yeah,
or AS rather.
constantly in pain.
All right.
So how would that affect like something?
Okay, so
like that?
testosterone is a potent anti-inflammatory. We've all heard of non-steroidal anti-inflammatories, Motrin, ibuprofen, Aleve, aspirin, things like that. Testosterone is an anti-inflammatory, so you don't need those things. That's why people say, I can tell when my pellets are wearing off because my joint pain starts coming back. That's the indicator to get your pellets. So that's why other people that you mentioned saying I start getting relief from my joint pains when my pellets kick in. So that's your answer. Yes, it will help.
Okay, and then the next one is like women that suffer from like vaginal atrophy. How does that take away like the pain and all
Right.
that? If you
So
went
what?
down the road
Yes,
for a
ma'am.
little ways?
Yes, ma'am. So she's describing dryness down below in the vaginal area because that's because of lack of estrogen.
Right.
Estrogen restores that. The pain typically is due to dryness. So if you fix the dryness, oftentimes that helps the pain.
Well, even with like Replens and stuff like that.
Yes.
It does not do.
Right.
what it needs.
So it's the whole tissues that will be helpful as a result because you're fixing the root. The hormones went away, which is why the tissues atrophied.
Right.
Restore the root cause, the tissues can come back.
Yeah.
Depending on how far they're gone, you might need laser treatments or things like that, but those will help. Okay, great question. All right. Thanks for having me. We're going to end the video.